the purpose of testing the patient by either oral or urine specimen testing is to determine whether or not the patient is compliant with their therapy, whether or not they may be taking other medications that can interfere with drugs that the physician's prescribing. It's critical to their practice, whether the doctor's aware of that or not. If there's an adverse event, a death in the community where medication's been diverted, or if it's the death of their own patient, their name is on that prescription bottle. Technology is developing today to where a pill itself can be traced by laser imprinting and putting barcodes and such on medications. The FDA is developing mechanisms in conjunction with private industry to be able to track medicines from the pill found at a crime scene all the way back to the patient, to the prescriber, to the pharmacy, to the wholesaler, to the manufacturer. The whole chain of custody can be traced at some point as these technologies develop. Obviously, if your prescription bottle is found where someone is overdosed, or it's your patient and they pull them up on a pharmacy check to find out where those medicines came from, the doctor is brought into that liability. As far as the community in general, I think that the physicians need to realize that the most lethal weapon that they possess is the pen that they hold in their hands. And prescribing medications without monitoring patients is like giving a patient insulin without checking their blood sugar. If the medicine is not being taken, if it's being put up in grandma's cabinet and the 18-year-old son or daughter is taking the prescription bottle to school or to parties or whatever, there are deaths that have directly occurred secondary to that patient's lack of monitoring. And that's really something physicians need to consider.